All right. Good morning, everyone. We're excited today to join again the American Indian Cancer Foundation and presenting today's webinar. And I'm going to hand it over, want to say welcome. Thank you for being here with us and let them introduce themselves. And we'll go ahead and get started.
Thanks, Monica. I'm Melanie Plusinski. I'm an enrolled member of the Bad River Band of Lake Superior, Chippewa, northern Wisconsin. That's where I grew up. I am the Prevention and Policy Manager at the American Indian Cancer Foundation. I've been here for about 3.5 years.
I'm Colin Welker. I'm a Prevention and Policy Coordinator here at AICAF. I'm originally from Michigan, and I have been here for about 3 months.
Today, we're going to be sharing and presenting on effective community engagement strategies for sustainable health transformation in American Indian communities. And I believe, so I just will note, I believe you can ask questions throughout if your mic is unmuted, and also you can type them into the text box.
So just a quick overview of what we're going to be covering today. We hope that you take away and learn and understand the importance of establishing community buy-in to support policy systems and environmental change initiatives in your communities, learn effective, culturally relevant community engagement strategies, and learn strategies for how to build a coalition to lead health and wellness change initiatives. So why is community engagement important? So we just want to start out by talking about that. It's really an approach that builds on cultural and social assets of a community, and there's a greater chance of success when we can tap into this approach. Engagement encourages the community to take part in the change process and identify changes that they would like to advocate for their own health and the health of their community members. And it's a way to make sure that community members' voices are heard. It also builds trust and meaningful and important relationships with communities and organizations like public health departments and yourselves working in those communities. So because of these things, community engagement is critical in making positive and sustainable changes.
So we just really want to emphasize just what Colin said, is that gathering buy-in from those who are most impacted by policy and systems changes is what supports sustainability and acceptance from the community of a new norm where change really happens. So the policy systems and environmental change approach that many of us, if not all of us, are familiar with is really meant to achieve the lasting long-term change that benefits and improves community health outcome in the long run.
So some different strategies for policy systems and environmental changes are listed below, and we're going to dive in and tap into those throughout the rest of the presentation. But kind of what we're going to cover is some community coalition building. We're going to look at a story and case study of what has been successful for us here at AICAF, using community events, feasts, and gatherings to get buy-in and engagement from community members. Something that we found successful or beneficial and positive is working with tribes to help them identify solutions and strategies that they would like to pursue to improve their community health. And we do that through these variety of different engagement techniques. When a strategy has been identified and community members and tribal staff come to consensus and come to an agreed understanding, we find that that's the best approach or course of action to make a positive change happen for a community. We help with strategic planning, and we're going to get into these examples as we continue on with the presentation. Media campaigns, too, are a big one that we're going to touch on in a little bit.
We just wanted to show a photo. This is a strong partnership that we have built with the Minnesota tribal community, and this is a coalition group who've been meeting now for over 2 years monthly, and it represents elders in the community. There are youth on this coalition, public health workers and staff, people working to support youth, and just parents and people who really care. So it's just a nice photo of a group that we have done work with. So effective coalition building case study, we're calling it, but it's really just a story of us and our partners and how they were able to make some pretty progressive policy and systems and environmental changes happen in their communities. So when we think about making that change happen from the beginning, sort of brainstorm phase, all the way through the trajectory of seeing norms change in the community, the framework of success includes these things: identifying your stakeholders and community champions. So stakeholders can be anyone impacted by the policy, those who may have power in decision making, those who really care or are impacted. It could be different depending on the community. And you want to be able to identify those community champions. So in the photo that I just showed, that would have been one of our first points of contact for the community dietitian and also the tribal health director, who were both on board with, we heard that coalition building can be really helpful for us to secure funding in the future and for us to advise leadership and make things happen. And so they were already open to partnership, and they were the champions that emerged in that respect. So within this framework, you also need tribal council approval, obviously, or whomever the leadership or however the structure works. So you'll be delivering in some way a case for change. Like, what is the need for change, and putting that information together to get your approval. The community engagement event or committee member recruitment, we'll talk a little bit more about strategies for that, but that's a part of achieving success. You want to be able to define your purpose. Also, public health prioritizing. So once you do the work with your group and you're able to identify possible PSC strategies, you can also then at that point have conversations around what do we want to work on first. If there are these big food policy ideas that we have, we might have to vote and come to establishing what do we want to go toward first. And sometimes that's the low-hanging fruit, where you're getting leadership and community more comfortable with things as you go along. Sometimes you want to start with that big piece because you know it's going to take time and effort to make that change happen. Also looking at policy development, so the actual drafting of the technical language, you may need assistance from an attorney or your tribal attorney, and we'll talk more about that, but these are all components of this sort of framework, or how we look at things in the way of moving toward achieving success. Community engagement, as we shared, and also community mobilization. So once you have the community's attention, what do you want them to do, or how can they help with the initiative? So another set of photos, we talked about having these planned events with a purpose and a reason for bringing people together. And so this was just an example. The Sioux chef, who's an indigenous chef, came out to the community. We brought him on to do, just to do a talk and to share with community certain things about foraging foods and how sort of his story of how he came to try to revitalize some of the indigenous diet and get people to understand how that impacts our body and our health and generations to come. And at this particular event, it was really nice that we had one of the coalition members' parents, like his mom, came out and she spoke after the Sioux chef gave his presentation, and she just stood up and told the community that it was meaningful to her to see these foods again that she had seen when she was just a little girl, and she felt like the ancestors would be happy to see that the community were going back in this direction toward eating traditional foods. So that was a really nice takeaway from this event. So this group they decided to call their group the Lower Sioux Health and Human Services Advisory Committee, and we work in partnership with them. They formed this 8-member committee. So I just showed that event, and at that event, community members were nominated to be a part of the coalition. So AICAF, as like a neutral partner, just stood at the front of the room and asked the participants. There were about 100 people who came, which was a pretty good showing from a small community. We asked them to just think about who are leaders in the community. If you think about someone who's really passionate about health, or who is already working to make positive change happen, who you go to for advice, who are those people? We had nomination ballots on the tables, and we'll share a template of that later. It's very simple, but it was an effective way to get people to think about who is the elder in my community that would be a good person to advise on health issues, and who is a youth, or who is a public health professional. So we had that really simple mechanism of nominating people to the coalition at that event. So the long-term goal that we hope to facilitate for this group is to increase community engagement, to establish a sustainable food system that improves access to healthy food, connects the community to healthy foods, and creates healthier families. So once those nomination ballots came back in, their public health staff within the tribe put together sort of a "this is what you'll commit to" information, and they called these community members and asked them to commit to a certain amount of time and what their role would be. And so really providing input toward programming across the tribe, toward how grant funds will be used, and also community needs. So each staff in their respective areas identifying where community needs are at. And they committed to attending one meeting per month, co-facilitated by ACAF, or it could be facilitated by really whomever is able to provide that service. And we did in the beginning provide some education, so it was sort of slow moving in the beginning. Before they were established and clear roles, they were just like, well, we're interested in PSC, or interested in this topic, or we have a clinic opening, we'd be interested in learning more about screening rates. So we were able to come and just provide that training and education to the group as well. Yeah, so their roles and responsibilities are to show up, which they did every week, and to provide input, to share their voice and really elevate what they felt were the priorities of the community that they want to see move forward. And this is just an example of a tool that we have available for anyone to use, and it's pretty simple to use this tool. So you have your objectives on the far left, A, B, and C. So those would be like the bigger, sort of broader things that you want to accomplish. It could be incorporating more healthy menu items into meeting and events. That could be just an example, and you would task that out. So what do we need to do to get there? And then you'll put that in your action steps and tasks. And maybe that is getting your approval, it's putting your case for change together. Maybe you need to engage certain staff people. So that would go into your tasks list. And then you would use this tool to identify, okay, that's established, who will actually do this? And that's going to be important to making sure that this actually happens. And then you have your timeline for when that will occur. And then any notes or additional resources and whether or not there's funding is sometimes important to establish as well. If you're planning a community engagement event, being able to identify, we have this grant funding available, or we don't have funding available, so we need to ask for that from leadership. So this is just a tool available to use, and we're always open to assisting if someone has questions about how to use it or wants review on it. We're happy to do that. So this is more information about just that group and establishing a strong foundation. So they did develop their structure of the committee, and they decided to nominate a chair. That was in 2015. We did the PSC prioritizing activity with them. So we had a talking circle where all these ideas emerged, and we developed them into PSC language, but there was a lot there. So we just wrote them on big sheets of paper and put them up and had the coalition members vote on what they wanted to work on first. The group secured funding for a Communities Eliminating Tobacco Inequities grant. And they wrote into the grant, we have already established this established group who is able and willing to work toward making this change happen. And so they awarded that grant funding in part because they had this strong group of people willing to work toward policy change. They then also secured funding through NV3, Community Action Grant, working on healthy beverage policy and diabetes prevention for youth. And they had a kickoff event, they called it, in the spring, where they shared with the community everything that was going on, these new grants that they had, and all the opportunities that were going to come down the line because of this sort of growing momentum. They were featured in the Native Health News Alliance, which was really widely disseminated, and it was just a story about their community change that went out and was published in August of 2016. And they also secured additional funding through Aetna for the Wichozani Cultivating Healthy Behaviors initiative. So this is all just information that shows sort of it was important for them to establish this group, which really benefited them to bring in new funding, which allows them to do a lot of really broad, really great positive work across the community. And this is a long list of their accomplishments, which I won't go through all of them because I already sort of highlighted. It started with this wellness dinner where the nominations were secured, and they were able to bring on 2 youth leaders to sit on their committee, and it's been really great for us at AICAF attending those meetings to see the youth leaders came on kind of quiet, not really comfortable with being a part of something like that, and now several months later they're really sharing their voices and sort of stepping into that leadership role, which is really nice to see. Colin will share a little bit about the healthy vending machines changes that they initiated and implemented. I'll also talk about some work around incentives for healthy vendors at their Big Summer Powwow. And then moving on through, we will talk about how they've established new guidelines and menu items and standards for employee meals that are served at their casinos for their employees there.
Thanks, Melanie. So I think we're going to talk a little bit about tribal law now. So there's an opportunity to work in partnership on policy drafting because it's kind of a big task and not all of us are policy experts. So we work and have a great working relationship with the Public Health Law Center, which is based here in Minneapolis, but they do work and assist tribes with technical language, policy writing and drafting across the country. So there's opportunity to partner with them, which is really great. And this slide highlights some of the terms that can be confusing and can vary from tribe to tribe and region to region. So you might be familiar with some of these terms. We'll just go through a few of them here. We can start with ordinance versus codes. So those are on there. Using the phrase code or code sections may bring stronger connotations of sovereignty in contrast to ordinances, which is often used to describe local government laws or laws for cities and counties. You look at resolutions too, that term, resolutions is on there. That is becoming quite popular. I've seen across many tribes working to pass policy systems or environmental changes, creating a resolution to do so. But it's really good to ask your tribal attorney, if you have those relationships, to see what's best suited for your tribe or tribal organization you're working with. That's good. Do you have any more there? This is just a picture, a screenshot of the adoption of the resolution by the Lower Sioux Indian community. Melanie gave a little snippet about this, but this is a great thing that came out of working with this community, is this healthy foods resolution. So we're able to share this with you, and it's located on our website under the policy tab for your review, and I encourage you to go check that out if you're working on healthy foods initiatives in your community. It's quite comprehensive, and we're going to talk about some of the key elements in it in a second. It involves the major areas of policy change and can be helpful as an example or a template for you if you're working on these initiatives. So go ahead and check that out on the policy tab on the ACAF website. You can download it there. If you look at this, this is just those key elements that I talked about. So one thing is supporting the availability, of Indigenous foods in the vending machines and healthy foods in the vending machines at the rec center and at the government center. So they follow a 75% healthier Indigenous foods policy, meaning that 75% of the foods in the vending machine are now healthy or indigenous. They use pricing and placement to promote the healthy items. We have some pictures in a second to show you what that's looked like for them. And they also include calorie information now, and it has to be provided. It also calls for policy to encourage vendors at the powwow, their local powwow, to provide healthy and indigenous foods. And if they do that, they receive a discount on the vendor fee, a 50% discount. So that's an incentive for these vendors to offer healthy and local and indigenous foods. And then we talk.
I was just going to add, so we keep talking about healthy and indigenous foods. We also need the reminder that you want to establish your definitions for those early on, and so that everyone is on the same page about what you mean when you say healthy. And so I don't have the definitions in front of me, but the coalition worked to establish those. What do they mean when they say indigenous? It means indigenous to their local area, their region, their land base, and they have their definition of healthy as well. But you have to establish those things up front so that when you're telling vendors you have to follow these guidelines, they have something concrete to go on. And as far as the discount to powwow vendors, the health director actually goes out and walks around to each vendor and has the sort of guidelines and checks and has a conversation with them, like, yes, you're approved to get your discount because you have these items, or this is actually not allowable. So there is some accountability and someone who is looking over
that. So the vending machine makeover, which was really exciting, it followed the USDA's Smart Snacks guidelines. You can find those at that link in the presentation. But the dietitian at this community had several meetings with the Burnix representative, and that's just the person or the company that does the supplying for the vending machines. So this person is very knowledgeable about the Smart Snack guidelines and is a vendor for many of the schools in the area. So throughout those conversations, they found that they were very accommodating and willing to replace those unhealthy snack options with healthier ones, and were willing to follow the new guidelines that were adopted by the tribe. Another exciting thing was working with the Tonka Bar Company to place their products in the vending machines, and that was a relationship that was established, and the Tonka Bar Company had not been in vending machines prior to this. So that was exciting to see these local or indigenous companies in the vending machine, being able to support and give back to a tribally owned company. The soda in the recreation center is now only available in 12-ounce bottles versus the 20-ounce bottles that were previously allowed. So in some of these pictures coming up, we can see these changes. So on the left, we have a picture of the previous vending machine before the policy, and on the right, we have one of the current beverage vending machine now. So these vending machines are located in the community's rec center, where where youth spend a lot of their time after school, summers. They are hanging out there, and so it's a place where they get food after school or during these times. So by creating these healthier options, we're changing the norm for these youth. When they go out and select their choice, they only have these healthy options now, or more healthy options, 75%. So it's normalizing these healthy food behaviors and choices. Another environmental change that is you can notice here is the paneling or the facade of the vending machine. On the left, it was a Pepsi machine, so that was prevalent for advertising, and now they changed it to an Aquafina one, which is of course water. So that's a nice environmental change, showing that youth are now being exposed to these to water as a norm too. So the next one is just the before and after of the snacks in the vending machine. I know these photos are kind of hard and difficult to see, but the one on the right is now updated to a more modern functionality, and it was able to make space for those healthier options that we talked about with the vending machine representative and supplier. Another change here was that the unhealthy options, that 25%, were moved to the very bottom of the machine. So we know from like a marketing standpoint, people are more drawn to things that are at eye level or at the top. So that's where the healthy options got placed. So again, here it's 75% of the machine is healthy according to the USDA Smart Snacks standards. So it's exciting changes to note.
So going back to what the Community Coalition worked to establish that they wanted to focus on, we shared that strategic plan idea and the work that we did to establish a strategic plan. And what it includes is guidelines for food and beverages provided at meetings, forums, and events occurring on tribal land or that are tribally sponsored, so the tribe is paying for that. And there need to be these guidelines and definitions in place for someone who's ordering food or beverages or planning a meeting and event to know that like soda is not allowed or candy is not allowed based on these set guidelines that have been established, approved by council, and that coalition members are sharing with the community that this is happening, this change is taking place. So area B, they wanted guidelines also for the employee dining program. I think I mentioned this briefly, but coalition members unfortunately are living with diabetes and trying to access their highest level of health status possible with living with that chronic disease. And so they shared, like, we have these long shifts in the casino and that's where we work and that's how we make a living, but there's not access to healthy food while we're there unless we bring it from home, which if you have kids or you're busy isn't always available for you to do. And so the coalition members and champions worked with the dining facility within the casino to establish some healthy menu options like soups and salads and vegetables, less processed foods that could be available for employee meals instead of what they had been having, which was, they described like heavy carb load of some fried foods or canned foods that weren't necessarily good for them maintaining their healthy blood sugar levels. And so that was a component they wanted to focus on. Area C was increasing the availability of purchase of health promoting foods and beverages in stores and other community food outlets. So this was their push to make changes in the retail environment in the community. And so the dietitian developed this plan that they would make it easy for community members to know what healthy options were there by putting a certain colored sticker in front of those healthy items, and then having signage on the shelving throughout the store to say some facts about maintaining health or some facts about things that you want to moderate, and just to make it more, change that norm for people going into the store. They're now reading those signage that wasn't there before, and they can be empowered to make their healthy choices even if it's incremental change for them. And this we just included as, sorry about that. Just a simple, a lot of the things we do, like I think they're not overly complicated. They're just ways to elevate the voices of community members and engage them proactively in being able to take ownership of making change happen in their community. So this is just one activity. We prompted the group with the question, it's 2019. What does the community look and feel like after implementing this ordinance? So the focus areas that I just highlighted, the group was brainstorming to think, like, what does a community look like several years later if these changes take place? And so we just wrote down their ideas. No ideas are bad ideas, and we just put them in this circle and called it, this is our victory. And people said things like they saw healthier elders, they saw more families out gardening, that there was a decrease in sales of soda across the community. They saw reductions in smoking rates, reductions in diabetes and healthcare costs. So these are some of the ideas they contributed in sort of their vision for victory. And we took that back and just organized it again in just like a simple table based on major groupings that we saw that were chronic disease prevention, focus on community and healthy people, what that looks like, and then food. and all of their comments. And they use this as a reference to share with their family members and with other community members, and then also presented it to tribal council. So this is where we are at today, and the we is really that community. And so they shared with us that the norm going back years and years was to have donuts and sugary coffees and even soda at breakfast meetings, just unhealthy food that's not going to make people feel very good. So that these are their tribal council meetings, and now they have water, fruit like black coffee and or 100% juice or other snacks that have been approved by these guidelines that are healthy. So council is on board, and that's really great to see and really inspiring. So additionally, we know that policy change doesn't just happen overnight. It's more than just a piece of paper with a signature on it. So where they're at right now with their food policy is they've established the vending machine change, the powwow vendor change, and the guidelines for healthy meetings and events, and they're still working toward getting input from casino employees on the types of foods that they want to see, because they don't want to just bring on menu items that people aren't going to eat or enjoy or order. And so they've sort of worked on this other engagement with employees to ensure that they have their opinions on what they would actually eat and order. So I just want to touch on this. Another colleague of mine, Amanda Dion, and I were invited or asked to go to this community to interview individually all of their 5 tribal council members. And we asked them just 8 to 10 questions on what was important to them as leaders when they thought about community health and future generations, the health of future generations. And that was a really inspiring experience, and Amanda and I were able to understand, not being from that community, that there are these commonalities and things that the leaders thought and cared about as far as barriers and priorities for their community. And we transcribed these interviews and put back together a kind of simple report, as well as a PowerPoint presentation with quotes from the tribal leaders that would play sort of on a loop at community events, and it would catch people's attention. They had photos on them with these quotes from their leadership. And so we were able to help support establishing that connection between leaders and community members, which might not work in every community, but it's just another way to engage the community with leadership and with each other. And this is one of the quotes. I think this was from the chairman, and he said that the biggest thing is listening. We as leaders need to know what members want so that we can go forward in that direction and guide our work to fulfill the actual needs of the community.
All right, so now we're going to talk about community events, feasts, and gatherings as a way to engage community members. It's a way we're going to talk about how to engage them to get them interested, on board. We find that they're really, community members are engaged when there are approachable events, they're native-led, they're made comfortable for attendees. We're going to talk about some examples of bringing in entertainment as a way to get people in a physical space and bring them together. And of course, food gets people to gatherings. So this is just, when we look at event planning, before you pick the date, time, and location, we have to think about these 6 things. So we have to first talk about the scope. So what are we going to do? And then what is the purpose of this event? We have to identify that. Then you have to think about the participants. Who is going to be the target audience of your event? Who do you want to be at the table, so to speak, or at the event participating? And then we have to talk about the context, which is what supports the event. So why is there a need for this change? So it supports the purpose. So this could be there are high rates of diabetes in the community. So we need to find out and see why there is a need for this change. And then the follow-up is really important. So what are you going to do after you hear and get information from the community. So this can be done through surveys, things like that, which we'll touch on. But it's really important to follow up once you get the information and get this buy-in started and gathered from the community, to follow up with them and stay true to what the community wants as you work forward and move forward on these positive changes. And then talking about results. So what are you going to do with the results of these gatherings? Are you going to share it with leadership, tribal leadership, the tribal board? Are you going to create a report back for the community? So these are just things to keep in mind when you're planning an event before you start. So some of the potential barriers to engaging the community, we have to think about these too. Sometimes it's hard to get people to that physical space and get them to come in. So many of the communities that we work in are rural and they're isolated. So that means sometimes people don't have access to transportation. So being very mindful of the location of the gathering is important, or the event. There could be different divides, or you have to consider the political environment, the current political environment of the community that you're working in. These are some reasons that people may not show up to an event. They may not have information or understand the value of the initiative that you're working on. So if we're talking about healthy foods, well, that might scare someone away if they don't have a comfort and are not comfortable with changing their diet. So selling it in a way that's exciting or new, saying fresh or delicious or exciting or local indigenous foods are going to be offered and talked about, could be a way to get people at the event. Another one is childcare. That childcare today is very expensive, and we want to keep families together. So having a safe space for youth or younger kids to go at the event is something to consider as well. So we want them to be also engaged in the community event. So having a craft or a sport activity, indigenous if possible, is great, and a great way to keep the family together while working on these positive community changes. So some of these buzzwords that we're talking about throughout this community engagements piece, and meeting the policy system environmental goals and objectives at the community event, these are just some different terms that we have. So surveys, these are just useful tools that can get us valuable information and feedback from the members of how the event went.
It's something that we can assist with. We've helped develop some surveys. Sometimes you don't know to start or what questions will be the most useful to ask. So that's something we're offering help with, if that would be helpful.
Yeah, we have a survey that we're happy to share. So it can also be an advisement or thoughts on the PSE change strategies that are being talked about or going to implementation. Recruitment can take place at these community events, at different focus initiatives. If it's at a community garden, it's a way to find volunteers, coalitions, things like that. Visioning, I know Melanie talked quite a bit about visioning, so that's really when we can learn what the community members want for their future, and what they want for the health and wellness of their community and its members. Poster competitions, that's a fun way to engage youth. We have some examples, I know, later of different drawings that I think it was Prairie Island community used, and it became their logo for their coalition. So it really has ownership. They really have ownership over their coalition and what they're creating and the changes that they're making. Normalizing health and wellness. So that's just like looking at an event that only serves healthy foods and beverage options at these different events that you're trying to talk about healthy foods. So walking the walk, not just talking the talk. So keeping the community aware. So this is places to keep the community up to date on our new wellness initiatives, media campaigns. I know Melanie shared about displaying the quotes of the tribal leadership at the health center. That's a great way to keep the community aware of what's going on and know that there's that connection between leadership and the community. And then showing accountability. Events, these gatherings are a place to report back the research or the survey results and the findings. And it shows that you're being accountable for the information that you're collecting from the group. This next slide is just a poster that was developed for the Prairie Island Indian community. We brought in a native comedian to get people to show up for an event. So that was a really exciting way to engage community members and to get them active in these health and wellness initiatives.
And we also worked with this particular entertainer because he leads a healthy, sober lifestyle. And so he talks about that and incorporates that into his kind of comedy and tells stories about himself, which makes it personal and more, interesting to the community and relatable. And he also was a part of the Truth campaign back in the day. So he has some good stories to share. So it's important that you know who you're bringing on and asking to come, that they, like Colin said, walk the walk, that they're good representatives of health in Indian country. So that event that we just showed the flyer with Bobby Wilson, that event, they had, I think, like 106 community members. They are even smaller than Lower Sioux, so that was a really good turnout. I know that there were some community champions and elders and cultural advisors who went out and recruited community members because that person cared a lot about seeing health outcomes improve in the community. And so we put up this big poster board. It was a family event for all ages to come, and there were activities for youth as well as this, but we just asked them to respond in whatever way. If they wanted to write words or draw pictures, what would a healthy community look like? And then we had a lot of like youth and kids come up and draw some photos, which are really cute. And we just took these actual drawings and put them into their strategic plan, which is just, I don't know, a really simple engagement to say like, oh, I remember this event. I remember I was there. Look at what this person contributed. Yeah, I agree with that. And so just a way to sort of, it is, I guess, a mechanism of follow-up to say, we use these and we'll be using this and seeing them every time we look at our strategic plan going forward. So this is another flyer example. This event just took place and it was organized in Bemidji to make the workshop accessible to multiple tribes in that region. And it was really about indigenizing movement, and the presenters also spoke about ancestral eating and really emphasized holistic wellness. And they do it and frame it in a way that is really, I think, relatable and accessible to people, just saying we're just regular people. Yes, we're really into fitness, but the movements that we do and want to share with you, anyone could do. And we all went outside, and there were elders and young people of all sort of walks of life in Indian country doing these movements together and breathing together and being mindful together. And I think just seeing people's faces, everyone really connected to it. And so just another example of an engagement event. And we have a video to show, so the group is called Well for Culture, and they are out of the Southwest, and they've been really great partners. And we also established this partnership with them to develop more digital media that we can use, because we know that's what's engaging to people, both young and old these days, rather than just print resources and things like that. So I'm just going to play the video and share with you.
Being active is one of the most important ways to maintain a holistically well and balanced lifestyle.
People often call it fitness today, but remember, functional training and movement have been a part of our indigenous way of life for hundreds and thousands of years. Our ancestors stayed active all day. The lifestyle was inherently wellness-based. Today is different. We have to make it a point to move with intention and to stay active.
Keep this phrase in mind. Movement is medicine. Through a well-balanced lifestyle, we can empower ourselves, we can prevent diseases like cancer, diabetes, and heart disease, and we can socialize in a fun and safe environment. Remember that it's not about looks and it's not about physique. It's about building strength from within so that we can become strong individuals, strong families, and strong tribal communities once again.
You might not think of the two in the same category, but remember that movement and indigenous languages are interconnected. Both are integral parts of all Native peoples' traditions and heritage.
Learning your indigenous language is a great way to sharpen your mind and carry on your culture. And moving actively is another great way to sharpen your mind and to challenge your mental physical capacity.
Now we are encouraging you to combine the two. You can learn active movements or simple exercises in your indigenous language. Anybody can do it. No matter your age, weight, gender, tribal affiliation, or sexual orientation, you have the ability to connect your indigenous language with your movement routine.
With some help from our friends, we'll show you how to move in indigenous languages. Because talking about fitness in our indigenous languages is a great way to bridge the gap between wellness, cultural revitalization, and language preservation.
That video is also available on our website, and it is longer and goes into movements. So if you have a meeting or event and you want to get people up after an hour and get them to do some movement together, you could probably pull some examples from that video.
There we go.
So moving on to community workshops for transformational change. I think this is just about different ways that we can build our capacity to better serve our communities. So taking those opportunities to learn new ways of facilitation or new ways to plan events and being thoughtful about it. So here you're participating in this webinar today. This is just that one way to sort of improve your level of knowledge and comfort with sharing these messages with your community members and constituents. You could also attend in-person trainings and do informational interviewing, really being thoughtful about accessing what's available to you, especially if you're new in your role. Like for me, just really doing the research and reaching out and trying to learn as much as possible is really important for engaging our community in a meaningful way.
And one way to do that is through community conversations. So just taking the time and having meaningful conversations with the community, hearing from them. So this is a picture of one that was done, I believe, around tobacco initiatives in the community. But it was quite a lengthy conversation. So just, again, taking the time to hear and learn and do your own research on how you can best help the community that you serve.
So I already shared about the visioning activity. This was just a photo of the group contributing and thinking through ideas together.
This one is just a picture of some health and wellness prioritizing and action planning that we've done with different communities. And this is kind of becomes the driving force in the work and lays out the work that's going to be done with the community. So that's a great way to, again, work collaboratively together to lay out your goals and actionable items to achieve these changes.
And we know like this process or these photos make it look like a complicated process, and everyone probably has their different ideas about how to do things, like pull out emerging themes or do really basic qualitative analysis after you have a community conversation. But it can be made simple and accessible to anybody, and it could also, you can also run through like mock trials of this. Is something that we do that makes it more comfortable. So, and just getting your materials ready ahead of time, thinking how you're going to lay it out. It doesn't have to be a science. It's just getting comfortable with doing that for your community group. So engagement via media campaigns. I'm aware that not every person working in a community might have approval to do things like use Facebook or Twitter or post on YouTube or engage in social media. But if you do have approval to do that, or if you continue to try to seek approval to do that in a way that works well for your community, it can be super effective in reaching broad audiences.
This is just one of our campaigns. I actually have the t-shirt on right now. But making it, this one is about Indigenous milk is medicine, so talking about breastfeeding and how that relates to cancer for us. The goal is to help educate all Indigenous people on the benefits of mother's milk, and relaying that information as the first Indigenous food, and normalizing that practice in a community.
And so we did posts on Facebook, we did a contest for drawings for t-shirts, and really thinking about ways that are easy that people can engage with the messaging. And then once they, walking around wearing a t-shirt or sharing a resource in the community is just a way to start a conversation about what is that, why is it important, how is it related to health. So another example of just a campaign, and we're talking about things that ACAF has done, but again, these are things that you can just take and translate, just ideas for things that you could do in your community. This one was in October around Indigenous Pink, and a lot of communities are having their own Indigenous Pink events and their own activities for that day, but we really promote Instagram and social media of all forums, like sharing photos to show that you're in solidarity with raising awareness about breast cancer and breast cancer screening. Another example, I think we did a Twitter chat around cervical cancer. I don't have Twitter, so I was afraid of engaging with it, but it's actually really easy to do. It's just a photo of our staff wearing the colors, just things that resonate with community. If you make it feel like it's an easy way to engage, and it is an easy way to engage, you're more likely to have people participate and have pride in the fact that they are aware and they're promoting something health promoting.
So the next couple slides are just examples of tools that we've created for community engagement. So I think we'll just click through them and show you kind of what we've developed. So this is our coalition building template that we've just created.
We're not going to read through all the text, but it's just to show that this is available on the website. I'm not sure where everyone is at as far as getting a group of people together to focus on an initiative, but this is just a step-by-step process that says these are things that you need to do and considerations you can have in order to get started, depending on where your level of readiness is to build a coalition. There's just more on that same resource, which is available to download as a PDF. And this is, we talked about nominating community members to a coalition. So this is just an example of a ballot that can be constructed easily, or you can even use our template and looking for who's an elder that you think of, who cares about health and is a go-to person in the community, an adult, youth, and so on, and then their contact information.
This next one is just another tool that's available to you. It's an event planning guide that is a step-by-step plan for creating an event. So pulls together all the pieces, which we've kind of covered, and making sure you have all those different components and are thoughtful and mindful about the event you're creating. Just another picture of it, the back side of it there.
So in summary, we have learned that utilizing community engagement strategies to bridge the gap in prevention, PSC change, and awareness is key in bringing our communities closer to ending the burden of cancer and other chronic disease in Indian country. So we have a couple minutes for questions or comments or feedback, and we will turn it over to you. Use our contact information as well.
Nice. Great. Thank you. Thank you both so much for this fantastic presentation. Thank you. Does anyone have any questions for Melanie and Colin?
Can you guys all hear us?
Yeah, yeah.
So I have a question for you, Colin. Where do we get our hands on that t-shirt?
That's a question for Melanie.
If you send us sizes, we can mail some out for you.
Perfect.
Yeah, just
fabulous t-shirt.
Thanks.
Anyone at all have any questions before we let Colin and Kristen go? Before you also leave, just a reminder that we have poll questions. And also, I see someone that called in on a 612-791-7150. Can you let me know who this is? (612), anyone? Okay, well, thank you, Melanie. Thank you, Colin. We are going to start our poll questions right now.
Okay. Perfect. Okay, you should see it shortly.
And Julie, there's a question on the chat about can we get a copy of the PowerPoint presentation? This is Jamali.
Jamali, we can send you over the presentation.
Thanks.
We'll also have a copy of the presentation uploaded to YouTube shortly.
They should have the.
We're doing a webinar.
Right.
Colin, that was an awesome presentation. Thank you for doing that. I need to leave and go on to another meeting.
Okay.
Thank you.
Yeah, you're
Thank
welcome.
you.
Monica, are we
Thank
closing?
you, everyone. It looks like we are done with the polling. And Melanie and Colin, thank you again.
You're welcome.
That was such helpful information, very informative. And just want to encourage everyone to visit the website for those follow-up surveys and other information, valuable information you have to offer. Thank you guys again.
You're welcome.
Thank you.
Thanks.
Have a good
Take
day.
care.